Are you concerned about the integrity of our healthcare system and the real impact of medications on your health? If so, this episode of The Diary of a CEO with Dr. Aseem Malhotra is for you. Dr. Malhotra, a leading cardiologist and public health campaigner, exposes the flaws in the current medical and pharmaceutical industries and provides insights on how we can protect our health through informed decisions and lifestyle changes. Here are 5 actionable insights from the episode. Question medication necessity. Dr. Malhotra highlights the overprescription of medications, emphasizing that many drugs, especially statins, may offer minimal benefits while having significant side effects. Before starting any new medication, discuss with your healthcare provider whether it is truly necessary and explore possible lifestyle changes as alternatives. Adopt a heart-healthy diet. Embrace a diet rich in whole, unprocessed foods. Dr. Malhotra recommends using olive oil as your base fat, consuming nuts and seeds, and including oily fish in your diet. Minimize your intake of sugars and refined carbohydrates to maintain optimal heart health. Exercise moderately. Engage in moderate physical activity rather than excessive exercise, which can be harmful. Aim for 150 minutes of moderate exercise per week, such as brisk walking or cycling, to support heart health without overstressing your body. Manage stress effectively. High stress levels can negatively impact your heart health. Incorporate stress-reducing practices like yoga, breath work, and meditation into your daily routine. Using apps like Calm can help guide these practices and improve your overall well-being. Advocate for transparency in healthcare. Support initiatives and policies that promote transparency in the pharmaceutical industry and healthcare system. By demanding better information and accountability, we can help ensure that public health decisions are based on accurate and unbiased data. In this episode, Dr. Aseem Malhotra, a renowned British cardiologist, critically examines the pharmaceutical industry, focusing on the harmful effects of overprescription and medication misrepresentation. He discusses his initial support for the COVID-19 vaccine, but now believes it has had a catastrophic net negative effect on society, potentially contributing to a rise in cardiovascular issues. This stance has sparked controversy and professional backlash. Dr. Malhotra highlights the systemic problems within the healthcare industry, particularly the influence of commercial interests on medical practices. He argues that profit motives lead to patient harm through overprescription, stressing the need for a shift from drug-based treatments to lifestyle changes and preventive measures. He emphasizes that lifestyle-related diseases, like heart disease, can often be better managed through diet, exercise, and non-pharmacological interventions. A significant portion of the discussion focuses on the dangers of ultra-processed foods, likened to new tobacco due to their adverse health effects. Dr. Malhotra notes that over half of the caloric intake in the UK and the US comes from these unhealthy foods, advocating for drastic consumption reductions to halve heart disease death rates. Dr. Malhotra also shares his personal experiences and the risks he has taken by speaking out against prevailing medical and pharmaceutical practices, facing criticism and threats from within the medical community. Despite the challenges, he remains committed to advocating for evidence-based medical practices and transparency in healthcare. He discusses the importance of social interactions and emotional health, recommending practices like hugging and maintaining strong personal relationships to boost immune function and reduce stress. Throughout the episode, Dr. Malhotra encourages a balanced and open dialogue about health, urging people to question established norms and consider alternative perspectives. He stresses that achieving better health outcomes requires a comprehensive approach, combining medical interventions with significant lifestyle changes. In conclusion, Dr. Malhotra's insights challenge listeners to rethink the role of pharmaceuticals in healthcare and the broader societal impacts of medical practices. His advocacy for lifestyle medicine and transparency in the pharmaceutical industry offers a compelling call to action to prioritize well-being over profit-driven medical practices.